So the project that we're going to be addressing, the problem that we're going to be looking at, is the crisis in children and young people's mental health across London and more broadly across the country. So now increasing over the last few years, up to around 1 in 5 children and young people have a diagnosable mental health problem, whether that's anxiety, depression, eating disorders or other common conditions. And when we talk to young people, they tell us 3 important things. They tell us that the system isn't fair, that there's too much variation between different services, between different areas. They tell us it's too late. They say they're not getting the support they need at the time that they really need to benefit from it. And they say that it's not joined up enough. So they say they might get lots of different support, maybe in schools, maybe at their GP, maybe from specialist services, maybe from hospitals, but we're not talking to each other as a system. So this work is building on work we've done with the Young People's Advisory Group, which is hosted by Inclusion Barnet. Yeah, so I remember that first session really well. I remember this young man who was talking about bereavement and the effect on his mental health, the effect on his schooling, how he'd got some good support, but often it wasn't joined up or it wasn't quite at the right time, or how that had worked.
Yeah, I know exactly who you're talking about, and that's a young person I've known for a few years, before the occasion you're talking about, and he's blossomed.
Right.
And it's partly from involvement in groups like that, but also having that ability to shape research and to shape policy with you and colleagues who are involved in that project. He felt a sense of achievement, a sense of belonging, that really helped him to flourish.
But I think also it's good to have that sense of challenge, because I talk to a lot of young people, but it's normally in a hospital setting or a GP practice, and the power dynamics are very different. The kind of conversation we have is very different.
Yeah.
So in previous work we've done in our patch in North West London, we've looked at access to primary care and secondary care, and we started working on things like risk prediction models. So how can we identify early those who are really likely to develop more severe mental health problems, and how can we target specialist mental health support to them a little bit early? Now those models are only as good as the data we put into them. So by adding in data from specialist mental health services, which we're planning to do as a result of this project, even from adding in data on schools, from social care and wider data about where they live, we're hoping we can make much more precise and better models that can really target that service, and also how we can make it a fairer service. So it doesn't matter where you live in London, doesn't matter which school you go to, doesn't matter what your ethnic background, it doesn't matter what your household circumstances, you still get the same access to the same high quality and effective services to support your mental health. So the other challenge we really want to take on in this project is improving the timeliness of services. We know that far too many children and young people wait a really, really long time to see the right person. What we're aiming for is that everyone sees the right person at the right time. So for many young people, if we can get in early, then seeing a mental health counsellor, seeing their GP, seeing a paediatrician or another service, often we can support them and they may not need that referral onwards to specialist mental health services. And if we can get that part right, then we can use the specialist mental health services to have a quicker response for those with more severe needs or with potential to get worse over time, who really benefit from that more specialist support. The third thing that we're really looking to do is to join up across services. So we know that children obviously spend a lot more time in schools than they do in health services, which is a good thing. Often schools are the first ones to really pick up when there's something going on, and often they're the ones who really need to support that child day to day in their life. Similarly, for many families involved with the social care system, it's really important that we join up the support they're getting within social care with what they're getting from health services. And also we need to support parents, we need to support youth services and lots of other groups who have an influence and have a role in supporting children and young people. What we're looking to do is to link up data, because until we get the linkage between data, say around attendance at school, or whether someone's got the right care plan around their specialist needs, that might be around autism or ADHD, or might be around other health needs, until we can get that data linked up with their health data, it's going to be really hard for us to identify the needs and really get those joined up services that young people tell us they need. So the exciting thing about this project for us is that we believe through the London SDE we can get better use of data, which will help us deliver fairer, more timely and more joined up services for all children and young people in London with mental health needs.